Hi, I'm Dr. Ashwini G.B. Today we are going to discuss about the pre, during and post-procedure instructions for an IUI or intrauterine insemination. Let's go to the pre-procedural instruction. Now, prior to the procedure, usually the doctor would suggest an injection called as a trigger. A trigger injection is an injection that causes the egg to release. This will be planned by a fertility specialist, which will be given 1 day prior or 36 hours prior to the procedure. So please take this injection on time and as instructed. There is no need for fasting during the procedure or when you're coming for the procedure. Sometimes some women may have very low threshold, and in case you feel you have a low threshold for pain and transvaginal scans also hurt you more than usual, then it would be good practice to discuss with your fertility specialist as to whether IUI can be performed under anesthesia. Most often, if ultrasounds, transvaginal ultrasounds are easy, IUI procedure also can be pain-free. Infection screening is a mandatory test both for husband and wife as per the law. So this test and its report should be available prior to planning for the procedure. At present, according to the ART Law 2021, it's also required and mandatory that the couple are in a wedlock. So the hospital or the clinic might ask proof for the marriage, which might be a marriage certificate or a passport supporting the wife's and the husband's name or any other government approved ID. And in the event that there is no official proof, an affidavit with a lawyer also should suffice to the clinic to say that you are a married couple. On the day of the procedure, husband will have to furnish a semen sample either on-site or off-site. So if it's a home collection, the clinic may ask you to sign a consent form that the sample was bought from outside. And once the sample is collected and furnished to the laboratory, the lab may take about 1 to 2 hours for the processing. As per the instructions for the wife, it would be a good practice to maintain adequate hydration and drink enough water to maintain adequately full bladder for easing the procedure or for comfort during the procedure. A full bladder has an advantage in the sense with full bladder, the cervical and the uterine angle become a straight line and inserting the catheter can be much easier with full bladder. It will also help adequate visualization under ultrasound in case the IUI is being performed under ultrasound guidance. The IUI procedure itself may take about 5 to 10 minutes time. It's very important to stay calm and relaxed during the procedure so that the procedure is easy for the doctor and comfortable for you. Once the procedure is done, the clinic and the support staff may ask you to rest for about 5 to 10 minutes. This is very important for the fact that resting will help settle the sperms that have been inseminated inside the uterus. Post the IUI procedure, that means after a rest of 5 to 10 minutes, the lady is free to go back to work and regular routine activities are absolutely okay. Try and avoid strenuous exercise for the day. The follow-up date for the pregnancy test will be decided by the fertility specialist, and you might be given a date for the urine pregnancy test or a blood test for pregnancy. During the waiting period, there might be additional supplements that might be prescribed. Please make sure that the doctor's advice is followed diligently. Most often, there may not be any symptoms or there may not be any indication during the waiting period of 15 days. But however, if you come across excessive spotting, excessive bleeding or excessive bloating and pain in the abdomen, it would be a good practice to go meet your doctor and get yourself examined. Wear comfortable clothing so that there is easy access for the procedure. Stay hydrated, drink enough fluids so that bladder is comfortably full and helps in making sure that the procedure is easy for the doctor. Stay relaxed and stress-free during the procedure, and that will help in making sure that the access to the cervix is easier, and ultrasound guidance might help in better visibility during the IUI procedure. Avoid harsh hygienic products because it might change the pH and actually affect the chances of conception.